Hello, my name is Allison Littleford, a current BSN to DNP student at Pittsburgh State University. Today I'm going to be discussing contraceptive screening and counseling to enhance provider knowledge using the recommendations of CDC and U.S. Office of Population Affairs from their report providing quality family planning. First, let's discuss why it is important for primary care providers to improve contraceptive counseling and screening. It is important to women and their significant others to plan timing and spacing of pregnancies. Nearly half of all pregnancies in the United States are unintended or mistimed. Unintended pregnancy has been associated with poor birth outcomes and broader social and economic impacts for women and their families. Barriers in women's knowledge of and access to contraception still persists. Addressing these barriers, including ensuring access to the most effective contraceptive, including long-acting reversible contraceptives, can lead to reduced rates of unintended pregnancy. You may be asking, what does unintended pregnancy really mean? According to the U.S. Department of Health and Human Services, unintended pregnancies is defined as any pregnancy that is reported by women as being mistimed or unwanted. The unintended pregnancy rate is significantly higher in the United States than in many other developed countries. Women who are at low income or less than 200% of the federal poverty level, and women who cohabit with men but are unmarried are at a higher risk of unintended pregnancy as well. You may be asking yourself, what is a reproductive life plan? It is defined as a set of personal goals about having or not having children and on the desired spacing between children. It also includes how to achieve these goals. All patients need to make a reproductive life plan based on their own values, goals, and resources. They need to think about when and under what conditions they would like to become pregnant. If they do not plan to have children, they need to think about how they will prevent pregnancy. According to the CDC, all women capable of having children ages 14 to 44 should be screened for their reproductive life plan. This should be assessed at least annually and clearly documented in their chart. If a woman of childbearing age presents to the clinic for another visit reason, address this reason and then assess for their reproductive life plan. Women already using contraceptive methods can simply be screened for continued use, documentation of compliance, and satisfaction of their current method. The first step to quality family planning is establishing and maintaining a rapport with your patient. Use open-ended questions. Demonstrate expertise, trustworthiness, and accessibility. Explain why the information is needed and how you will use it. Encourage the client to ask questions and share information. Listen and observe the client. Be encouraging and demonstrate empathy and acceptance. The second step is obtaining clinical and social information from the client. This includes a medical history. This should be taken to ensure the contraceptive methods being considered are safe for that individual client. Review their pregnancy intention or reproductive life plan. Discuss their previous contraceptive experiences and preferences. Their sexual health assessment and risk assessment considers the client's previous practices, partners, their STD history, and helps the client choose the most appropriate method or methods of contraceptives. The third step is to work with the client interactively to select the most effective and appropriate contraceptive method. Specifically, the provider should educate the client about methods the client can safely use and help the client recognize potential barriers to their chosen method. The provider should discuss a broad range of methods, including long-acting reversible contraceptive, with all women and adolescents if medically appropriate. For those who have completed childbearing, permanent sterilization is an option that can be discussed with the patient. When educating clients, it is important to discuss the following: the method effectiveness, correct usage of the method, non-contraceptive benefits, side effects, and protection from STDs, including HIV. The fourth step is conducting a physical assessment related to the contraceptive use only when warranted. Most women will need no or few examinations or laboratory tests before starting a method of contraceptive. Unnecessary medical procedures and tests might create logistical, emotional, or economic barriers to contraceptive access for women. Blood pressure should be taken before initiating the use of combined hormonal contraception. Providers should assess the current pregnancy status of clients receiving contraception. The following examination and tests are not needed routinely to provide contraception to a healthy client. Pelvic examinations, unless inserting an intrauterine device or fitting for a diaphragm, cervical cytology, or other cancer screening, including a clinical breast exam, HIV screening, laboratory tests for lipid, glucose, liver enzymes, hemoglobin levels, or thrombogenic mutations. Step 5 is providing the contraceptive method along with instructions about correct and consistent use, helping the client develop a plan for using the selected method and for following up and confirmation that client understands. A broad range of FDA-approved contraceptive methods should be available on-site. Referrals for methods not available on-site should be provided for those patients who indicate they prefer those methods. When providing contraception, providers should instruct the client about the correct and consistent use. Provide on-site dispensing if possible. Start contraception at time of the visit if the provider can be reasonably certain the client is not pregnant. Provide or prescribe multiple cycles, ideally a full year's supply, to minimize the number of times the client must return to the clinic. If a client chooses a method not available on-site or the same day, provide the client with another method to use until she can get the chosen method. CDC recommends that clinicians obtain a sexual history at a patient's first appointment and at all routine preventive appointments. However, research has shown that less than 40% of healthcare providers are estimated to obtain or document that they've obtained a sexual history from their patients. I have included a helpful tool for conducting a complete sexual health assessment. This includes partners, practices, protection from STDs, past STD history, and pregnancy. This is a helpful tool published by the CDC using their guidelines to be reasonably certain that a woman is not pregnant and when it is acceptable to start contraceptive methods at the visit. I have included this image because I feel it is a good visual tool to use in the office setting with patients to discuss available methods, their effectiveness, and possible side effects and other considerations. I thank you for your time and appreciate your participation in this scholarly project.